Hi, I am Dr. Stout, and I have been here 19 years. It'll be 20 years in the summer, which is kind of crazy. So it's the only place I have been, and hoping it's the only place I'm ever going to be. I am somebody who has always known I wanted to be a pediatrician. I didn't discover it when I was in high school or med school. I can remember being a 10, 11, 12-year-old, and my mom had a home daycare, and helping her with the children in her daycare and knowing that I always wanted to work with children. So I entered basically high school and all my schooling with a singular goal of I want to be a pediatrician. And now that I am a pediatrician, I would never choose anything else. I think my goal in being a pediatrician is trying to integrate the many parts of a child's healthcare into one place. So my goal is, if you have asthma and you're my patient, I want to help you manage that. If you have ADHD or anxiety or are struggling with mental health, I want to be the person that helps you and guides you through that, whether that's seeing me for an appointment or whether that's me helping you to find the resources that you need, whether I'm the one that's specifically providing it or whether I'm helping you find the specialist or the other people that can connect with you in that care. One of my favorite stories is I have a patient who came in and they cut their hair. And mom was really upset because her beautiful hair, it's been cut off. And I go, oh, let me pull out my phone and I will show you the pictures of my daughter. When my daughter was 4, she got up in the morning. My husband had left scissors out in the kitchen. She decided to give herself a haircut and came in and laid in bed with me, and I put my hand on her head and immediately woke up because she had chopped like this and a chunk in the back. And she was so very proud of herself. And so when I showed this mom the picture of my daughter, she was like, oh, okay, you do understand. I tell parents all the time that I have 4 children, and don't worry, at some point, I am going to make you feel better about something with your child because I've already gone through it. One thing that I wish parents knew about well checks and sports physicals is that I have had patients, they just came in for their well checkup, and I found something that we needed to do something about. And I might catch that heart murmur, or I might talk to your kid and they divulge that they're being bullied or that they're sad. And if we didn't have that touch point once a year, then we wouldn't pick up on those things. I also think it's important to have those yearly checkups because it helps me build relationships. So if I have built a relationship with your child for the last 5 years and they're now 10, they're going to trust me and they're going to tell me things they might not otherwise tell somebody else. And then it allows me to help. So it's super important to bring your child for their well checkup every year so that I can make sure that not just that they get their school form, but so that we can have that touch point where I can make sure your kid is healthy and continue to build that relationship with them and you.